Good morning. I'm Dr. Christine Selvey from New South Wales Health with the COVID-19 update for Wednesday the 17th of November 2021. There were 231 new cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night. There were more than 88,000 COVID-19 tests reported during that period. Across New South Wales, 94.2% of people aged 16 years and over have received a first dose of COVID-19 vaccine, and 91.3% are fully vaccinated. Of those aged 12 to 15 years, 80.7% have received a first dose of COVID-19 vaccine, and 73.9% are fully vaccinated. There are currently 207 people with COVID-19 admitted to hospital, with 33 people in ICU, of whom 15 are being ventilated. Of those people in ICU, 24 people are not vaccinated, 4 have received their first dose of COVID-19 vaccine, and 5 have received 2 doses of COVID-19 vaccine. New South Wales Health's ongoing sewage surveillance program has detected fragments of the virus that causes COVID-19 in sewage samples from Gerringong, Giroa, Holbrook, Grenfell, Lithgow and Wauchope, where there are currently no known cases or no recent cases. Everyone in those areas is urged to monitor for the onset of symptoms, and if they do develop symptoms, to immediately go for a test and isolate until the negative result is obtained. New South Wales has high vaccination rates, but we do need to remain vigilant and increase their vaccination rates as soon as we can. If you haven't been vaccinated yet, please don't delay any longer. Even if you've had COVID-19 illness, you should still get vaccinated. In this phase of the pandemic, the onus is on every one of us to keep each other safe, especially the most vulnerable people in our community. If you have any symptoms at all that might be COVID-19, please have a PCR test at one of the many clinics. While rapid antigen testing is very convenient, and it's also very useful, especially in workplace situations where there's frequent testing, rapid antigen tests are not as accurate as PCR tests, the PCR test being done in a laboratory. If you do have a positive result on a rapid antigen test, you must get a PCR test at a COVID-19 testing clinic as soon as possible to confirm whether or not you do have COVID-19, as a positive test doesn't necessarily mean, a positive rat test doesn't necessarily mean that the PCR test will be positive. It's important that if you do have COVID-19 that you have been diagnosed with a PCR test done by a laboratory, and that's because a positive PCR test you will get linked into clinical care, and that's early, and that's very important for your own health, as even young and healthy people can sometimes get severe illness from COVID-19, and the illness can sometimes get severe suddenly, so it's important that people with COVID are linked into the clinical care system. It's also important to remember that a rat test, the rapid antigen test, isn't suitable for people who have COVID-19 symptoms. So please have a PCR test if you do develop symptoms. The rat test may be negative even if you do have COVID-19. So please get a PCR test because it's more accurate than the rat test. Thank you.